Welcome to Lesson 1. What is medical billing? One of the most popular search terms that brings people to our website is the question, what is medical billing? So we're going to go into that and describe what a medical billing specialist does and what their primary responsibilities are. Just to give you an overview of the medical billing process, it's the process of getting the provider paid for their services is really what it boils down to. This is payment from the insurance carrier, and it's also payment from the patient for any uncovered charges or any deductible charges. A good specialist knows how to get the provider paid promptly for the services that they perform. And their duties cannot be easily automated. Much of their tasks are interpreting physician notes and records, verifying the correct patient information and insurance information, and making sure that the correct coding has been used. It's all pulling this critical information together, making sure that it's accurate, and assembling it into one claim. And that's just getting the claim filed. It also has to go through the insurance payer adjudication process. So once the claim is processed and paid, applying all the payments has several other challenges that cannot be easily automated. A billing specialist frequently must interpret payer coding error messages and correct them, resubmit claims, and provide additional documentation to get the claim successfully paid. A medical billing specialist could also be referred to as an insurance billing specialist because so much of what they do is dealing with health insurance companies and payers and interpreting and understanding how they operate. Health insurance can be very complex and it can be very frustrating because there are always changes in codes, in policies and guidelines, and not just from the insurance payer themselves, but also from government regulations and government laws. In smaller physician offices, the billing specialists, they can handle a wide variety of tasks. Medical coding and medical billing are separate, but they are closely related. Both of these functions are critical to getting the provider paid, where the medical coder analyzes patient charts and assigns the appropriate alphanumeric codes, the standard diagnosis and treatment codes that are used throughout the industry. The coders and billers both access medical records for their work, but the difference is the coder uses patient records to determine the appropriate codes, where the biller uses the medical records primarily for payment of these services. I want to talk a little bit about the reality of billing and coding. Like I mentioned, the medical billing specialist in smaller practices may be kind of a jack of all trades. In an ideal world, once the coder has determined and assigned the appropriate codes, it's the medical biller's responsibility to make sure that this information is correct and to prepare and submit a claim with this information. So when the claim has been successfully paid, the biller posts these payments. They determine what amount the patient is responsible for, and they reconcile the account. For smaller practices, they can't justify having both a full-time coder and biller, so they typically have many of the same codes over and over again that they use, and it's important for the biller in these situations to have some knowledge of coding for the specialty. Periodically, you have to look up the diagnosis and treatment codes, the ICD and the CPT codes, and understand the modifiers and recognize when the codes are correct or incorrect. And the Billing Fundamentals course, we go into much more detail about what the billing specialist needs to know with regards to coding. Situations where you have both a medical coder and a medical biller are typically for larger healthcare providers like multi-physician practices, clinics, hospitals, places that will see a lot of patients and have a centralized coding and billing department. So some of the typical tasks of a medical billing specialist, I've titled this Jack of All Trades because it encompasses a wide variety of tasks and responsibilities. But the medical billing specialist starts out creating and maintaining patient account ledgers in the practice management software. They determine the patient responsibility based on their particular health insurance plan. They may have to look up medical diagnosis and treatment codes, the ICD-10 and the CPT-4 codes. They enter the information from the patient registration forms and the superbills into the practice management software so a claim can be created. They need to understand managed care authorization and coverage limits and communicate with the insurance payers occasionally to resolve claim problems. Continuing on, some more of the typical billing tasks are to transmit claims to a clearinghouse or insurance payer once the claim has been created, to send patient statements out and occasionally answer questions about the patient bill, to run reports on the outstanding claims and patient accounts. These are called aging reports, to coordinate any delinquent patient accounts with a collection agency if you have situations where a patient account has been turned over to a collection agency, and also to enter the insurance and patient payment information into the practice management software or the patient ledger in the practice management software. So next we're going to talk about the payment or the reimbursement process.